welcome to our lecture on the diseases of the newborn animals, particularly of livestock animals. This presentation shall talk about the special sensitivities of the newborn animals. We also have the perinatal and the postnatal diseases of these newborn animals. We are going to classify them and we are going to give examples. And also we are going to talk about the causes of mortalities of these newborn livestock animals. So these are the special sensitivities of the newborn animals. Of course, the newborn animals are considered to be immunologically incompetent, no, as compared to their adult counterpart. It would take a few days, no, depending on the species, before this immune system or before their immune system will be fully developed. Newborn animals also are dependent on adequate colostrum at the right time. So there is a time wherein this colostrum will be available, and the newborn animals must be able to suck the colostrum in order to develop its immunity. We also have dependence on frequent intake of readily available carbohydrate to maintain energy, and relative inefficiency in maintaining normal body temperature. So they are still unable, to regulate their uh, temperature or their body temperature, so that for their thermal requirement, they need an adequate supply of available carbohydrate in their diet. So these are the perinatal and postnatal diseases of the newborn animals. So you usually classify this according to the stage or according to the time before, during, or after the parturition, or before, during, or after birth. So of course, first we have the fetal diseases. Now we also have the parturient diseases. And for the postnatal disease, we classify it as early, delayed, and the late postnatal disease. So how do we define fetal diseases? So when we say fetal diseases, these are the diseases of the fetus during the intrauterine life, or during when the fetus is in the uterus. So these are examples of the fetal diseases of the newborn animals. We have the prolonged gestation, congenital defect, intrauterine infections, abortion, fetal death with resorption or mummification. So of course, we have to be observant of the length of the gestation period of the different domestic animals. So when, for example, it exceeds the prescribed number of gestation days, so it can result to prolonged gestation. We also have the abortion. So abortion is the expulsion of fetuses before the proper time of parturition and has multiple causes. Of course, the abortion could either be infectious or non-infectious in nature. We also have the mummification. So when we say mummification, that occurs when the intrauterine fetal death is followed by autolysis and absorption of the fetal and placental fluids. So in mummies or in mummification, the uterine contents remain sterile, but the fetus becomes dehydrated. It typically occurs during the middle or last one-third of gestation. So this diagram shows a necropsy photograph of a mummified fetus associated with prolonged gestation. So the prolonged gestation is 347 days, and the body weight of this is 3.3 kilograms. So the breed is Aberdeen Angus cross Holstein Friesian. So of course, when we are going to, this is a prolonged gestation, so meaning that it exceeds the normal gestation days in cattle. So the normal gestation days is about 280 days. And the minimal gestational age for viability in days for a calf is 240 days. So all animals must be born close to term if they are to survive in a normal farm environment. So this is a prolonged gestation. It exceeds the normal length of gestation by more than 50 days. So this was taken from a 347 days gestation. So clinical examination reveals that the fetus is dead, although the dam is pregnant. Transrectal palpation reveals an irregularly shaped contracted uterus with a fetal mass but no fetal fluid within it. No, there is no fremitus in the uterine artery. So ultrasonographic examination of the accessible parts of the uterus per rectum confirms the diagnosis. So how do we treat this type of condition? So the abnormal pregnancy can be terminated by a single IM injection of prostaglandin F2 alpha. So the PGF2 alpha will help to expel from the uterus the fetus and can be manually removed also from the vagina 48 hours later. So this photo reveals the mummified fetuses in stillborn piglets submitted for post-mortem examination. So two of the litters, so we have here the litter 1, litter 2, litter 3, and litter 4. Two of the litters A and B were recovered by the farmer in the farrowing pens were gilts showing signs of imminent farrowing such as nest building activity and mammary development, farrowed at a delayed stage, which is more than 118 days of gestation. So again, for pigs or sows, the normal gestation days is about 114 days plus or minus 3. And the minimal gestational age for viability for each of for the sow is, or for the gilt is about 108 days. So below this, it could result to uh, below this, no, the piglet could not be viable or it cannot survive in the farm environment. And one of the litters was also recovered after the gilt was slaughtered at the abattoir. So this one here, the litter was recovered after slaughter. And of course, we have here this one here are considered to be mummified, and we have also here a series of mummified fetuses. So of course, they vary from the picture. They vary in size, and their size could be one of the bases in determining the stage where mummification have occurred in the gestation of the piglet or the gestation of the sow. So these piglets here are considered to be stillborn piglets as opposed to this one here which are mummified. This diagram shows the mummified pigs, the size of the mummified pigs relative to the age where this mummification has occurred. So this age here represent the gestational days wherein the mummification has approximately occurred. So for example, when the size of the mummified pig is 20 millimeter, the mummification could have occurred on the day 30 of gestation. For sows, the normal gestation days is 114 days, now plus minus 3 for farrowing. So from approximately 30 days of age through to 114 days or 115 days, the fetus is maturing. This means that the skeletal system is developing, and if the piglet dies, it is not completely absorbed and a mummified fetus remains. The approximate age when a mummified pig has died can be determined by measuring the length from the crown of the head to the rump or the tail base. So these measurements here are taken by measuring the rump or the crown of the head of the piglet or the mummified pig towards its tail base or the rump. So what causes mummification? So there are two possible causes of mummies. The first one here is the piglet dies because there is a large litter and insufficient space in the womb. It could also be due to non-infectious causes such as the environmental factors. And we also have the infectious causes, usually a progressive nature at any stage during the period of pregnancy. So of course, when we say infectious, the disease could either be a viral disease, could either be bacterial disease or other infectious pathogens which can cause mummification. So by measuring the size of the mummified pigs, we can determine at what stage of pregnancy the disease occurred or at what stage of pregnancy the mummification occurred. So alternately, if the mummified pigs are of variable length, this is evidence of progressive disease over a period of time. So some viral infections affect the fetus from day 30 onwards and progressively spread during the period of pregnancy. For example, the porcine parvovirus is a typical example of a viral disease that is considered to be progressive in nature. So when the size of the mummified pig is 20 millimeter, the disease could have occurred now during the day 30 of gestation. When it is about 200 millimeter, the disease now could have occurred, or the mummification could have occurred at day 60 or the day 70. So as the size of the mummified pig increases in length, there is also an increase in the gestation day wherein the disease could have possibly occurred or the mummification could have occurred. So what are the significance of the mummified piglets? So when there is a large number of normal piglets born alive and a few mummified pigs, this could imply that the condition is unlikely to be due to a disease or an infectious disease. When there is a small number of piglets alive and a large numbers of mummified pigs, the condition is more likely to be due to a disease or an infectious disease. For example, a litter size of 14 alive, 1 dead, 1 mummified is of no significance, provided the remainder of the litter is normal and healthy. If, however, the litter size is 6 born alive, 2 dead, and 4 mummified, this could indicate that the disease during the pregnancy could cause the mortality. So for example, when you have recovered this number of mummified piglets, for example, you have a litter of, uh, for example, now you have a litter of 12, which is the normal litter size, and you recovered 1, 2, 3, 4, 5, 6, 7, 8. 8 of that are uh, mummified, and this could possibly be a stillborn one, although it is autolytic in nature. So, halimbawa, meron kang 1, 2, 3, 4, 5, 6, 7, 8. 8 are mummified, 1 is autolytic or stillborn, and the remainder, so you have 9, then so you have 3, about 3 born alive. So this could indicate a possible infectious disease. Now, because you have a larger number or you have more mummified compared to the born alive. This table shows the infections that can produce mummified piglets. So the one with the asterisk now represents the more common causes of mummified pigs in sows. So the first one here is the Otis disease virus. The Otis disease, AD, or it is also known as pseudorabies. It is considered to be a notifiable infectious disease of pigs, and it is caused by herpes viruses. And we also have the other one, the porcine parvovirus, or the PPV. It is a common and important cause of infectious infertility in sows. It is a robust virus that multiplies normally in the intestine of the pig without causing clinical signs and is ubiquitous in pig populations worldwide. Another major cause of mummified pigs is the PRRS virus, which stands for Porcine Reproductive and Respiratory Syndrome. It is a devastating viral disease that causes abortions, so not only mummification, but also abortion, stillbirths, as well as premature farrowings in sow herds, and respiratory disease and reduced growth in growing pigs. So the more severe clinical manifestations occur in the late gestation, characterized by abortion up to 40% abortion rate, as well as in early farrowing, no fetal death, and the birth of weak, congenitally infected pigs, resulting in the elevated pre-weaning mortality. We also have the SMEDI viruses. So when we say SMEDI, that is an acronym for stillbirth, mummification, embryonic death, and infertility. It is a reproductive disease of swine caused by porcine parvovirus and porcine enteroviruses. We also have the parturient diseases. So these are the diseases associated with dystocia, causing cerebral anoxia or fetal hypoxemia, and their consequences and predisposing factors to other diseases. So again, when we say anoxia, that refers to the absence of oxygen. When we say hypoxemia, that is the below normal level of oxygen in the blood. Let's now proceed to the postnatal diseases. So the postnatal diseases are classified according to the stage wherein the disease occurred after birth. So it could be early, it could be late, or delayed. And for the early postnatal diseases, so these occur within 48 hours of birth, and this is usually non-infectious and metabolic in nature. Examples of this are hypoglycemia and hypothermia due to poor mothering, hypothermia due to exposure to cold. And other examples are malnutrition, low vigor or low vigor, naval infection, and colibacillosis. So what is hypoglycemia? So when we say hypoglycemia, now that is the term for low blood sugar level. And during the first few days of life, the newborn piglet, for example, is unable to mobilize the low glycogen reserves in the liver to provide adequate levels of glucose in the blood. It is therefore dependent for the energy on a regular intake of lactose from the sow's milk. So this could be prevented by providing the piglet with the colostrum in the first 24 hours. So hypoglycemia in piglet is important because it can cause the piglet to be laid on belly. It can cause shivering, starvation, paddling, fits, and convulsions, frothing at the mouth, salivation, comatose, and the eyes can be sunken and the head bent backwards due to dehydration, and it can also cause high mortality. So for the treatment, now it includes the condition must be recognized early if the treatment is to be successful. Immediately remove the piglet to a warm draft-free environment to achieve a 30 degrees centigrade ambient temperature. So a box well bedded in shavings with an infrared lamp above is ideal. So the piglet could also be fed with a sow, or alternatively, cow's colostrum or 20% dextrose solution by syringe or stomach tube every 20 minutes until it has returned to normal. Then, the piglet can be introduced to a newly farrowed sow. So this diagram shows the interactive events occurring in the hypothermia, starvation, crushing complex. So these three factors are the major contributors to the mortality of the newborn piglet and increasing the pre-weaning mortality. So these are the different factors that will influence the development of these conditions. So for example, when the piglet has a low vitality, meaning that it is weak, it is a low birth weight, it is more likely to develop hypothermia because it could not, for example, it could not take in or suck colostrum readily, because it is weak in hypothermic. And when also the piglet is weak or hypothermic, of course, it can starve. The environment is also another factor because when there is not enough of the provision of heat, it could lead to hypothermia. When the sow has a poor maternal instinct, a poor maternal behavior, it could lead to crushing of the piglet. So crushing is, in some studies, it is considered to be the major cause of piglet death. And Also, when the sow has a poor maternal instinct, of course, there is a tendency that its piglets will starve. We also have the delayed postnatal diseases. So this occurs 2 to 7 days after birth or 2 to 7 days of age. And examples of this under this is the colibacillosis, joint eel, lamb dysentery, and most of the viral enteric infections in young animals such as the rotavirus and the coronavirus. In piglets specifically, we have the condition known as the neonatal colibacillosis. The most common symptom in neonatal pigs is diarrhea. So in terms of the appearance of the diarrhea, so it can be mild to profuse, watery, whitish to light brown. But of course, this is not definitive. This is not pathognomonic. And this is often observed within hours of birth, mostly between 4 and 4 days of age. So what causes this is the enterotoxigenic E. coli or the ETEC in suckling piglets, and it is most as often associated with litters derived from gilts, which become infected quickly after birth due to environmental contamination and inadequate maternal antibody levels. So to prevent this, vaccination of late pregnant gilts and sows should be performed routinely to induce lactogenic immunity for piglets against the ETEC infections. So in calf, we also have the neonatal diarrhea or the calf scour. So again, when we say scour, that is synonymous with diarrhea. It can be defined as an increased loss of water through the feces. And the cause of diarrhea can be classified as infectious or non-infectious. For the environment, the when the environment is the cause, this can result from improper meal administration and also inadequate housing. For the infectious causes of neonatal diarrhea or calf scour, these could include the rotavirus and the coronavirus. Of course, when treating diarrhea, there are two general principles of therapy. We have to treat the cause and to treat the signs. And for non-infectious causes, of course, we have to eliminate any negative environmental influences. And for the infectious scars or infectious causes, the causative pathogen must be eliminated. To combat viral scars, vaccination of the cows can protect calves by conferring passive immunity. We also have the late postnatal diseases. So when we say late postnatal diseases, this occurs at about 1 to 4 weeks of age. And examples of this are hypogammaglobulinemia, which is caused by a low serum immunoglobulin or antibody level. We also have the enteric and the respiratory diseases, cryptosporidiosis. Of course, when we say cryptosporidiosis, that is, of course, the protozoan parasite now caused by the Cryptosporidium parvum, and it is one of the most important diseases of young ruminant livestock, particularly of cows. We also have the white muscle disease and enterotoxemia. So for the white muscle disease, it is a nutritional myopathy of cows, that is caused by deficiencies of selenium or vitamin E. We also have for the enterotoxemia, it is also known as the overeating or the pulpy kidney disease, a condition caused by the Clostridium perfringens type D. So these are some of the diseases that can occur in the newborn animals at 1 to 4 weeks of age. So the slides to follow will enumerate the different causes of mortalities in livestock animal species. So the diseases of the newborn and neonatal mortality are considered to be a major cause of economic loss in the livestock production. For the lamb mortalities, it is said that most of the mortalities in lamb occurs within 24 hours of birth. And most of these are physical and environmental in nature. The specific causes are a complex of hypothermia, hypoglycemia, and starvation. We also have the dystocia. Of course, dystocia can cause stillborn. or stillbirth, and abortion. So most of these are considered to be environmental in nature, so that nutrition management in delayed pregnancy is key to reducing, for example, dystocia, and also providing adequate colostrum supplies now to prevent the development of hypoglycemia, hypothermia, and starvation. For the dairy calf, these are the specific causes of mortalities. We have the fatal disease, postnatal septicemic disease, enteric disease, and the respiratory disease. So in some studies, it is said that neonatal mortality in dairy calves is about 10% under 1 month of age, and this can be caused by dystocia. So high calf mortality can also be due to inadequate planning, overcrowding, and labor, and failure to feed colostrum early. So in beef calf mortalities, it is said in the Radisich et al. Now that the rate of mortality is about 5 to 6%, and of course these are from the US now available data. For the specific causes, we have hypoxia, traumatic injury. So of course, this can be caused by traumatic injury, for example, during dystocia, difficulty in parturition. So it can cause a traumatic injury to the fetus, and of course, it can result to hypoxia. Exposure to extremes in the environment, too hot or too cold environment, mismothering, especially for first time to calf, he first. We also have the neonatal diarrhea. We also have the stillborn. It also a cause of mortality. Hypothermia, of course, when the calf was not able to suck in colostrum, and also twin-born calves. These are the specific causes of piglet mortalities. We have the infectious diseases, so these are infectious causes of the diseases. We also have the congenital or genetic abnormalities, weakness at birth, crushing is of course one of the major causes of piglet mortality, and trampling by the sow and starvation. This diagram shows the causes of the piglet mortality in one of the study in a herd, and it lists down here, it enumerates the different causes of piglet mortality. So the most common cause of piglet mortality that have been listed in this study is crushing, followed by pigs that are not viable, runt pigs, diarrhea, and other causes. The contributing factors that can increase the pre-weaning mortality in pig production system. So of course, we have here the different factors, the interplay of these factors that lead to the piglet mortality. Now, of course, we have the hypothermia, starvation, and crushing. So we have here arrows. This means that all of these are interconnected to each other. So for example, when the piglet is hypothermic, of course, it won't be able to suck in colostrum readily. It won't be able to suck milk from its dam more often, so it could lead to starvation. When the piglet is starved, it is weak, so it can readily be trampled or crushed by the sow, especially when the sow has a poor maternal instinct or poor maternal behavior, and it has no the it is not a good it has no good mothering ability. Of course, in hypothermia, that is associated with the environment. So, for example, when the environment is it has a draft, it is not draft free, and there is no provision of adequate uh, temperature. So, of course, it could lead to hypothermia. And of course, hypothermia is caused by inadequate, in the for example, inadequacy in the carbohydrate intake. So, for example, when the piglet was not able to suck in colostrum, so of course, it will not have the glucose that will be necessary to produce uh, thermal heat or body heat, and it can lead to hypothermia. So when the piglet born is of low viability, so meaning it is underweight, So, and it is also weak. Of course, it will be starved. It will be starving because it will not be able to suck in, no, to suck in the colostrum and the milk from the dam, and also it will be more prone to being hypothermic. So these are, the factors that are contributory to piglet mortality and will increase, the pre-weaning mortality. Fetal porcine diarrhea is considered to be one of the major causes of piglet mortality. And these diagram shows a fishbone diagram of the factors that are important for the occurrence of neonatal porcine diarrhea, known as illustrated by Larson in 2016. So these are the different factors that are contributory to the occurrence of neonatal porcine diarrhea. Start with the management. So for example, when the sow farm does not practice an all-in, all-out system, so of course it has a poor management system, and this could lead, to the development of neonatal porcine diarrhea. So when there is no all-in, all-out system, the different age groups of pigs are mixed, in one housing. So of course, when, for example, the sow, or the piglets are housed together with the older pigs. So the older pigs already have, the immunity that are necessary to combat, for example, diarrhea as compared to piglets. So they would be more prone to developing the neonatal diarrhea. We also have the environment, of course, when the piglets, are not provided with a proper temperature. Of course, they are more prone to neonatal diarrhea because, again, piglets cannot are not capable of regulating their own body temperature. The next is the colostrum intake. Of course, this is on the piglet factor, and this is very important in order to develop immunity. It should be taken during the first 24 to 36 hours. We also have the maternal factor, and this is related to the sow. And when the sow is dysgalactic, right, it is deficient in the milk. So of course, it will lead to the piglet starvation and to piglet diarrhea. We also have the immunity vaccination. So when the sow, for example, is not vaccinated, it has no immunity. For example, the gilts, uh, it has not yet given birth, so it does not yet have the immunity against a certain diseases that causes diarrhea in piglets. So the piglets are more prone to developing diarrhea. Of course, we have here, the one of the most important factor are the infectious agents that can cause, the diarrhea, in piglets. These are the different factors that could lead to increasing the piglet mortality. So these are, some of the factors that can cause the contributory factors, in the piglet mortality, increasing the pre-weaning mortality. So from this portion here to this portion here, there is an increasing welfare compromise of the piglet death. These are the different factors that can contribute to the development of, for example, this one here, asphyxiation, um, reduce in the colostrum, and poor maternal behavior. And this can result, to the development of these uh, factors, that can lead to the piglet mortality. So this is your assignment, and this is included in the oral exam. Another factor that can lead to the increase in the piglet mortality or to the occurrence of the piglet diseases is the breeding management. So in this diagram, you have here the effects of failing to control the mating program. So we have here the two major factors: too many sows mated and too few sows mated. So these factors now can lead to the development of the piglet diseases. Also, this is included in your oral exam. For the foal mortalities, the causes include the foal being born immature, structural defects, infection and injury. So, for example, injury during the dystocia, the birth of the foal. We also have here in a study posted in the Equine Disease Quarterly. So these are the major causes of foal mortalities that have been presented to the University of Kentucky. The majority of all the neonatal deaths occurred by 30 days of age, 67%, and the top five causes of death include septicemia, musculoskeletal issues, rib fractures, and we also have pneumonia, GIT problems. So under this, for example, we have the neonatal diarrhea, and we also have the rib fractures.